Hello and welcome everyone to the Data Challenge Prenatal Care in America. My name is Tracy Flood. I'm president and co-founder of the Broad Street Institute. I'm really excited to welcome you all here today. The Data Challenge is to create a portfolio project that can be shared with a key stakeholder about prenatal care in your region. We're talking about local data. The Airtable team will be making an indicator list. Diana and Angel will be presenting in the Airtable room, beautifying your data in Airtable and specifically setting up an indicator list and organizing data in that way. We'll pay close attention to the topic of prenatal care, why we chose it, and also talk about why we always are thinking about key stakeholders when we're designing data projects. Gotta think about that key stakeholder when looking at data. Let's proceed with the plan. We're going to start with an intro, and then we're going to proceed to a step-by-step. Before trying it, it just takes practice. It's a little bit about us. My name is Tracy Flood. I'm president and co-founder of the Broad Street Institute. I'm based just outside of Milwaukee. It is cold here right now. It is winter. All right, I've got my slug mug here too, just for good luck. Slug mug. I have 10 plus years as a community health data doc where I use data to run diagnostics on the health of America's communities. I really do believe that data skills are the key to unlocking solutions to this generation's greatest challenges and that we can all make a difference with data. Broad Street is a registered nonprofit. First and foremost, we focus on data training and supporting each other. It's a place built for learners, by learners. Data is just one of those things that's a lifelong skill, and we're always learning how to try to make a difference with data. We're not affiliated with any of the tools we'll be using today, but if Airtable ever wants to sponsor us, we would welcome that. Here at Broad Street, we believe that data heal the world. We believe that data is a catalyst for important conversations and creates a bridge to shared solutions. And of course, when we say data heal the world, what we mean are data people heal the world. They become that voice sitting around the table, taking a little bit of an extra perspective on any challenge that we might be facing. And we think that perspective is incredibly valuable. Our big picture goal, our vision as we move forward is that if we share sources of local data, it will help to catalyze community action and maybe have a cascading effect to more evidence-based policies, programs. So building in all of the things that we've learned about how to promote health so that we can have a healthier nation for all. All right, ground rules, spread hope, share solutions. We know that even though it's cold outside, the political temperature is rising. We understand that. We try to harness our passion for public health through spreading hope and sharing solutions. We find that a positive view of what we can do ourselves, the actions that we can take right now, is really the way to empower ourselves and to prevent things like feelings of overwhelm or burnout. So please join us as we spread hope and share solutions with our actions and our messages. I want to address a very common feeling with data, and especially if you're new to some of these data tools. Please know that there's something about data that is very intimidating. I've been there. I did not start my career in data. I started my career in medicine, and I came to data after that. There's definitely always a little bit of imposter syndrome when it comes to trying new data tools and to learning about new data sources. And data people are always have that feeling of we're never quite the experts. We're always asking questions of experts, and we're learning about how people use the data with boots on the ground. And that feeling of being an outsider actually can get to a person. I will say that. And that imposter syndrome, I think, can be reframed as humility. And I think it can be reframed in a way where we ask lots of questions. And it can be reframed in a way where we join communities like this to tinker and try and to troubleshoot and to learn new things. Data are a lifelong skill, and all the data tools as well. But please know that if you're feeling a little bit nervous or if you're feeling like you have imposter syndrome around data, I've been there. And I think a lot of people have too. I got over my imposter syndrome when I realized the world needed data people, whether or not I felt ready. We just had to go for it. So I wanted to share that because it's a very real feeling. And I think as data people, we always feel a little bit like we're learning always. Let's start. Data challenge. What is a Broad Street data challenge? A little bit about prenatal care and a little bit about why we talk about key stakeholders. All of the Broad Street data challenges cover a public health topic, are designed to take 20 minutes, at least on the walkthrough, and use free data tools. They involve a data hunt, they involve practicing data tools, and they involve making a project for a key stakeholder. Key stakeholder, what does that mean? It means one person who will look at the data, and if data are shared in a way that makes sense to them, this person can take action. We really believe in data for making impact. It doesn't work just chucking data in any format at somebody if that's not how they process information. So understanding that if we're talking to the governor might be interested in the entire state, might be interested in what they can do. So each person, each key stakeholder has a thing that they're wanting to know in order to tell if they should prioritize a public health topic. So getting into the head of that key stakeholder is really an important part of the data design and portfolio project process. This is what we call human-centered design first data. Our data challenge is to create a shareable portfolio project about prenatal care in your region designed for a key stakeholder. The data hunt today, we're going to be looking at HRSA's maternal and infant health mapping tool. We're going to be looking at different data tools as well before making a project for a key stakeholder in our step-by-step walkthroughs. Learning objectives. By the end of the data challenge, everyone will have found local data on your region or a region of interest. We'll be practicing using data tools. Data skills are kind of like musical instruments. The only way to learn is to practice. We'll be practicing those, getting some hands-on experience, and then creating a portfolio project designed to be shared with a key stakeholder. Of course, the bonus objective is also to connect. This is a small world, and those who love promoting health and love working with data can really get to know each other through live events like this one. If you're watching the recording, feel free to make a comment and say hi. We've got everything that we need. We've got you. We don't need any money. We're using free tools only, free data sources, free data tools, and a portfolio project with tutorials already prepped, which is awesome. Here's why we want to focus on prenatal care. We chose the topic of prenatal care because it impacts community health. It's an important community health topic. Improvement is possible. This is something we know how to improve. Evidence-based solutions exist, but it might not be happening everywhere. Pregnancies should be free from fear, and up to half of pregnancy-related deaths could be prevented with recommended prenatal care, especially early prenatal care. The social ecological model means that if somebody is not getting early prenatal care, there's a lot of things at play, including policies, including community and environment, the clinical care environment, interpersonal relationships, and individual beliefs as well. So it's a very complex issue with no one cause. If somebody is not getting prenatal care, we never shame or blame with data. These are complex issues and part of a larger model. We're not the only ones that feel this way. The county health rankings and roadmaps out of the University of Wisconsin definitely lists prenatal care under clinical care and is considered a social determinant of health. If we talk about upstream and downstream indicators, I sometimes think of upstream and then cascading effects downstream. Prenatal care has both upstream determinants and also downstream health outcomes. So prenatal care is really pivotal and is at the crux of health and pregnancy. So downstream prenatal care is associated with reductions in morbidity and mortality, as well as infant mortality. And upstream, there are things that impact whether or not somebody gets prenatal care, clinical care access. Is there something nearby? Is it affordable? Do you have health insurance? And whether or not you have health insurance might depend on affordability and policies in the state. So hopefully you can see that a lot of different factors come to play in the central indicator of prenatal care. That's my intro to what is a Broad Street Data Challenge, a little bit about prenatal care, and a little bit about why we talk about key stakeholders. Now let's proceed to part two, step two of the plan, is step by step. The Airtable team will be making an indicator list. Diana and Angel will be presenting in the Airtable room.
Okay, thank you. Let's get started. Yeah.
Hi, everyone. Thanks for joining our workshop. My name is Angel. We're going to be doing an Airtable workshop today. I am from Central California. It's kind of cold here and have been with Broad Street since June 2025.
Hi, guys. I'm Diana Saad. I am from Southern California, and it's actually very sunny here, so I'm sorry. And I started at Broad Street Institute February of 2025.
As you might expect, Diana and I both have a really big passion for exploring data and using tools like Airtable to help us organize information as effectively as possible. Having trained over 50 people while in Broad Street using Airtable, we're here to help guide you all step by step so you can leave the session with practical skills that hopefully you'll apply in the future. So today we'll be learning how to use Airtable and how to create an indicator list specifically for one central indicator, which will be prenatal care today. So by the end of this session, we hope that you all will be able to create an indicator list in Airtable focused on prenatal care. Your list will include percent of women who receive prenatal care in their first trimester, and then uninsured percentages for women 18 through 49. In addition, we'll have OB/GYN provider rates also in here. These will have indicator names, county statistics, data source, and then citations. You'll gather your data from HRSA's maternal and infant health mapping tool. Data will be collected from the county level, and then our main goal is going to be to obviously help you all build your Airtable skills so you can organize data as effectively as possible, present it clearly, and then use it to strengthen your advocacy efforts. By the end of the session, you all will understand the purpose of an indicator list, which will help you find and organize relevant data that will impact a health priority, such as the importance of prenatal care. Indicator lists allow you to support data-driven decision-making and what evidence-based policies should be implemented and then where. Indicator lists are very important to demonstrating what policies or resources are needed in communities the most, and then where in those communities should you set priorities to use them. Another key objective of ours is exploring data sources. Identifying relevant indicators for a health priority will enable you to identify gaps and determine where resources can be most effectively used. Data from HRSA provides essential demographic data and then different health indicators to help you better understand the impact of a lack of prenatal care for mothers and then their infants. Finally, you will gain practical skills in navigating Airtable, including how to hide fields, filter data, and organize indicators in a clear and concise way. Airtable will help you organize systems, create a story for a specific health priority, and then manage data as opposed to something like Google Sheets, which is mostly used for analyses. Airtable is a digital tool used to organize and track information in one place. Think of it as a mix of Excel, Google Sheets, and Project Tracker. It is smarter because it allows you to manage more complex data without needing advanced technical skills such as coding, which I'm not good at. Airtable helps you create a story with your information. In addition, you'll be able to organize information such as health indicators, different statistics, data sources, community partners, stakeholders, and more. Using logic models will help you create a data story. So an indicator is a measurable characteristic used to help describe and monitor the health status of a population or system. It is important to note that indicator lists do not always track change. So that's one big thing you should take away. For example, hypertension percentage of those taking medication for high blood pressure, physical inactivity, obesity, so on and so forth, or sales of cigarettes for tobacco use. An indicator list is a list of those measures typically made of secondary data that can be used in several different ways, like describing the health needs of a population in community health needs assessment, monitor contextual conditions related to health, and defending or opposing health policies. Indicator lists rely heavily on secondary data, so they are used for surveillance as opposed to rigorous evaluation of interventions, which requires primary data. Secondary data refers to existing data that is not collected by you. It can be generated from different surveys that are out there, large government institutions, healthcare facilities, so on and so forth. In other words, it's usually publicly available data that someone else already gathered for you.
Thank you, Angel. Today, we're going to be focusing on maternal and infant health. And so that is our main priority for our data. And our central indicator will be prenatal care. Prenatal care refers to essential medical care during pregnancy. It includes checkups, screenings, health education, emotional support to monitor both maternal and fetal health. So prenatal care is a critical upstream indicator because it directly influences downstream outcomes, such as maternal and infant mortality. It's also actionable and preventative, meaning early and consistent care actually allows risks to be identified and addressed before complications arise. So ultimately, access to quality prenatal care can significantly improve the chances of a healthy pregnancy and birth. So in Airtable, this is what an actual indicator list would look like. This is an example of one. The health priority for this particular indicator list is hypertension. So we can see here under this stage of model, it's listed as an indicator list, and then various indicators such as taking medication for high blood pressure, no exercise, obesity. And then we have a description for it, the percentage, what the indicator is actually going to show, what this data is going to show, of course, our data, and then data source and a citation. So this is just one example of what an indicator list might look like in Airtable. If I actually go to Airtable, this is another example. This is from the community health needs assessment. These are demographic indicators. We have some indicators based on race, education, and of course, the source would be American Community Survey, US Census, query details, year, and really with an indicator list, you can add a lot to your table to create this indicator list. As you can see, there's sections, indicator types, years. So all of this will play a very important part. And then we have some more indicators to show you guys, number of live births, how it pertains to infant mortality, its category, and then we have early prenatal care, something like that, and married mothers. So indicator lists really show you what data you need and what data might be missing too. So it allows you just a clean organization of your data. And like I said, you can really put any columns you think are necessary for your indicator list. For today, though, you will each be given a workspace. And so in that workspace, we will be focusing on selecting a specific county in Airtable. So we have a few examples right here for you, as well as the United States, which will be benchmark. So any data that you collect, you can compare it to the United States. And so that's there for you guys. You will start here where there's this little finger pointing down. You will start here putting your email that is associated with your Airtable account. And then you're free to pick what county you want to focus on. It can be your own county. It could be a county that you know might be in need. And then also your state. Please include the state, and then the prenatal care in the first trimester. So that's data that you'll find on HRSA, which I'll show you that mapping tool. It's a great mapping tool that I'll show you. Keep in mind of the years as well. So the data is going to kind of vary with years. So it's 2020 to 2022. That's what HRSA had. And then we can see it on the flip side. So no prenatal care in the first trimester, and then no prenatal care fraction. And then you can actually basically select whether it's high or low compared to the US based on your county. So for example, with Merced County, the no prenatal care percentage is actually higher than the US. And then a phrase will be generated based on the information that you have inputted into these boxes. And then, of course, with the other indicators that you'll be searching for, the uninsured women, 18 to 49 years of age, that as a percentage. This, I believe this is 2021, but I do believe it's actually lower now. I think it's probably at 10%. But as of 2021, which is the data we have, it's 11.6. Data source may not always give you all the data. So, for this workspace, we are requesting that you just focus on HRSA mapping tool. But for example, this 38.0 for the OBGYN provider rate per 100,000 women. For the United States, that's actually from the KFF. So it's actually not from HRSA. So that's something to keep in mind. Not all indicators will come from, or not all data will come from the same resource. Once you are done, you can select right here. There's a down bar. You can put done. You'll automatically get this little cute automation gift celebration. Or if you are in progress, you can put that. Or if you need any help from Angel and I, you can select support squad needed. So what's great about Airtable is it actually has a lot of AI tools. So this is an AI community summary that actually will be generated based on the information that you have put in, as well as these little illustrations. I think like 3 months ago, they weren't really including eyeballs and like these little oranges, like details, but now it's actually advanced a lot. So now it looks really good and cohesive. So we have AI illustrations that will pop up based on the county that you select. And then of course, please include a citation. Your data source will come from the maternal and infant health mapping tool. Again, this is a great resource that I will demonstrate. Now, in Airtable, just to show you guys, you can look at your data in different views. So, for example, here's what the indicator list would look like. We have uninsured women, the OBGYN provider rate, prenatal care in the first trimester during these years, and this can all affect both infant mortality and maternal mortality rates. Again, both of these are going to symbolize access to care, which is important for a prenatal care in the first trimester. So this is a view that you can look at, but for you to put in your input or to input your data, you would want to start here. You can also look at it in the gallery mode, and this actually will show it more cohesive. So for example, for the United States, we have the little illustration, the AI community summary, the no prenatal care percentage county versus the US benchmark, your team member status, obviously your prenatal care in the first trimester. And this is actually what you will be screenshotting so that you can show that you or prove that you did the challenge. So keep that in mind. We'll repeat that again once we go off into our teams. Now, with your data, this is the HRSA maternal and infant health mapping tool. It's really cool because it has all these layers that you can kind of play around with. And we have health indicators. This is where you're going to find the prenatal care in the first trimester. You also have infant health equity, which actually just shows the infant mortality rates. Health resources, so that's where you're going to find the OBGYN provider rate per 100,000. For some reason, HRSA is a little bit down, so if you press I to try to figure out the data code book, it's down now. I have no idea why, but what's great is we still have that data that you can look for. And the demographic characteristics is where you're going to find the percentage of uninsured women right here, 18 to 49 years of age. It also comes in a number, but for your Airtable, you can just put the percentage. So this basically will highlight the entire United States, but here in this little box, search box, you can actually, for example, let's look up Milwaukee. And it creates this is Milwaukee County and Wisconsin, creates little border boxes, and you can actually hover over it and press on it, and it will show you uninsured women 18 to 49 years of age as a percentage, which is 8.8. And then you can come over here and let's say Milwaukee County was my county that I chose, and I can just input it right into there. For the health resources, for the OBGYN provider rate, we can do the same thing. So we come down to health resources and then click on within the borderlines of the county that you've chosen. And so we have 29.8. So we can input it into our column. Okay, now if you have any questions, we will be separating into teams so that you can try it out. So with the little fingers that we have down here, please start into here when you put a new record, okay? And if you are unable to do the activity, thank you for coming to the module, listening to the module and figuring out Airtable. It's a really fun tool. Angel and I, we both started without any Airtable skills. And then we have helped a lot of people with Airtable now. So it's really, really fun to see the data and to see all the cool tools that Airtable has. Thank you for coming.
Give it a try, because honestly, the best way to learn something new is to practice.